If you're hypermobile, strength does not come from lifting heavier. It definitely comes from learning how to control your joints better. When I talk about controlling your joints better, I'm talking about coordination of movement. I'm talking about joint stability. There is a difference between flexibility and instability. When you are hypermobile, your joints are unstable. Flexibility is a very healthy thing to have, but instability is the polar opposite of flexibility because the joint is whatever given joint that we're talking about is unstable. You can go beyond what the normal range of motion would be and give you the illusion that you're flexible when in reality your joint is being unstable. Strength only happens when proper mechanics are in place. When you make an attempt to try to strengthen an unstable joint, you're simply going to hurt yourself. And I know you already know it. I know you've already belonged to groups and you talk to your other bendy friends where you know that they go to work out and they hurt themselves, or they go to the PT and they hurt themselves. That's because the standards do not apply. The standards do not apply to anyone, hypermobile or not. The only difference is in a normie body, the tolerance for doing the wrong thing is a little bit higher. So I treat joint hypermobility and I use developmental exercises. They are the same things you and I and every walking human being on the planet Earth has done, going from the time we were born, all the different things we did until we became running toddlers. Those different stages of movement, those exercises are what allow our body parts that are compatible and are belong to the same great team to make the work, the movement safe. We put them together following those same patterns. So, for example, in order for you to have a healthier, stable shoulder joint, you need to know proper movements of the neck, your mid back, your arm, and your breathing. These are all different pieces of the puzzle that come together to support safety of the shoulder joint. So when it comes to trying to stabilize a joint or your all of your joints and try to maintain that stability, you got to understand what proper mechanics of movement are, what principles of movements are, and become more aware. My patients with hypermobility are my smartest patients. They are the most eager, they're the most educated patients that I have. And I know you investigate things and I know you look into things. So these are the things that have to happen before you make an attempt to strengthen something. So instead, investigate in learning how to do proper developmental exercises, and then you lay the proper foundation, and with repetition you build strength. Listen, you didn't go to a gym to lift weight when you were an infant, and yet you became a running toddler at some stage of your life. So keep that in mind and do understand that things do matter. Your breathing does matter. Biological breathing is the proper way to breathe. If you have not subscribed to my channel, please make sure you do. I will put the video that I did on bendy breathing, on biological breathing, at the end of this video. But make sure you subscribe to my channel, educate yourself on what matters, and do know that there is a solution to unstable movement, even if you are hypermobile. Thanks for watching.